I'm Dr. Ashwin Mallya, Senior Consultant, Urologist, Uro-Oncologist, and Robotic Surgeon at Sir Gangaram Hospital, New Delhi. Today, I'll be speaking about the diagnosis and treatment of prostate cancer, which is organ confined. So, in the diagnosis of prostate cancer, we mainly depend on a blood test called prostate specific antigen. So, if you have an elevated prostate specific antigen, the next step is to get an evaluation by a urologist who will examine, and after that, probably get an MRI of the prostate. From the MRI, we come to know whether you need a biopsy or not, because there are many causes for elevation of PSA. So it is not prostate cancer specific, it is prostate specific antigen. So the urologist has to interpret whether there is a suspicion of prostate cancer or not, especially by examination and by the findings on MRI. After the MRI of the prostate, we do a biopsy taking specific cores from the suspicious areas. And once we have the biopsy cores, we have the diagnosis of prostate cancer. After that, we confirm whether the disease is organ confined based on a PSMA PET scan. So PET scan will tell us whether the disease is confined to the prostate or has it spread to the lymph nodes or to the rest of the body in the bones or the liver or any other organs. So once we have a diagnosis of organ confined prostate cancer, further treatment depends on many factors. It depends on things like whether you are a fit patient and can tolerate surgery, whether what is your age, what is the expectations that you have, and the extent of the disease that is there, whether it is spread to the lymph nodes or whether it is surrounding areas are also involved. So in the present day and age, we have very good surgical options for organ confined prostate cancer. So the best surgical option is something called robot assisted radical prostatectomy, which is robotic removal of the diseased prostate gland, along with surrounding lymph nodes and fibrofatty tissue, and the seminal vesicles and vas deferens, the tube which takes the sperms. So the operation is a 2 to 3 hour operation, and it is done through small incisions on the abdomen. And these small incisions heal very quickly. The advantage of robotic surgery is there for the surgeon as well as for the patient. For the patient, it entails very quick recovery from the surgery. You will be back on your feet the very next day. You will have a urinary pipe for 10 days, and after that, you can pass urine on your own. So the procedure, how it helps the surgeon is we have a very good magnified vision. The prostate sits deep in the pelvis of the body. So we have a very good magnified vision. We have very good control of the instruments, and we can do excellent surgery with very good functional and cancer outcomes. So robot-assisted radical prostatectomy is a very effective treatment for organ confined prostate cancer. The adverse effects of surgery could be urinary incontinence for about a month or two following the surgery, which recovers very quickly. Even in that, we have developed techniques where we can give you very early return to normal continence. And there could be erectile dysfunction. So coming back to your previous erectile function takes around 6 to 12 months. And with the help of medications, we try to get it back earlier. This is possible only if the disease is confined to at least one side of the prostate and not both sides, so that we can spare the nerves on one side which are supplying the penis for causing erections. So following the robot assisted radical prostatectomy, we keep on regular PSA follow-up, and which will help us decide whether you need any further therapy in the form of radiation or hormone therapy. So do not neglect a raised PSA. If you have a raised PSA, please contact a urologist and see how to proceed. So I hope that was useful information. Please share it with somebody who may need it. So this is Dr. Ashwin Mallya from Gangaram Hospital, robotic uro-oncologist. Thank you very much.
Thank you so much.